Hello, happy Friday. I haven't been live in a really long time, but I thought I would hop on live to just chat about some of the things that have been going on lately, talk about some new research. And if you are joining live, say hello. But if you are on my mailing list, I'll send this out, this replay, because I'm going to talk about some of the women's health research. I set aside some time. I try to do it once a week, but let's be serious. I don't do it once a week. Just talking or going through all the latest research in women's health, in the things I focus on, cycle regulation, hormones, menopause, perimenopause, and I try to just stay up in the up. Hey, Katie, I miss you. I try to just stay up on the latest stuff. So today I just wanted to deep dive on vitamin D a little bit because there's some research that has come out on vitamin D and I am obsessed with vitamin D. And, you know, if you're going to say, Laura, I know everybody's deficient, so I'm going to take it anyways. I want to talk about a few nuances for that with respect to vitamin D. So when we talk about vitamin D, one of the biggest things, or one of the biggest things my patients tell me is, I got my vitamin D tested, it was deficient, and my doctor said take 1,000 IUs per day. And I'm like, there's a couple problems with this. Number one is that the way that we should be testing, and then we should be dosing, and then we should be retesting in about 3 months' time. And the reason for that is that you actually need to be hitting a target with your vitamin D levels. And no, you do not pee out extra vitamin D. I've had a couple people say that to me in the past few weeks. I'm like, that's not true. You actually can take too much. But when it is tested and dosed appropriately and then monitored and then, retested, then things can be a bit more balanced. Now, the research has actually shown recently that we need our levels to be, so when you look at the lower limit of vitamin D, 75 is going to be the lowest end of vitamin D levels. You need it to be 75, at least for bone health. So that's kind of how they set the guideline. But we actually know that when it comes to women in perimenopause and postmenopause, we actually need your vitamin D levels to be between 100 and 150 in order to reduce to have the lowest risk of cardiovascular disease and all-cause mortality. So we need to set our standards a lot higher with respect to how high our levels should be. And so what should happen is you should have your levels tested. You should be dosed according to your weight and your level. So if your level's like 30, you're going to be dosed different than if your level's 50. But the goal is ideally to get someone to around 150. Sometimes we overshoot a little bit, sometimes we undershoot, and that's no problem. Then we reassess and we get the dose that's going to be your maintenance dose. Now, when I put someone on a maintenance dose, what I do is I put them on a dose. So if they've hit their target, let's just say, I'll put them on a maintenance dose and they'll be on that dose for a year. I do that because I want you to have 1 year of that dosing to see how it holds up over the winter, over the summer, as your levels are supposed to increase over the summer. A lot of people don't. Like, a lot of people assume that their levels are going to increase because, it's summer and I'm outside. And that honestly doesn't happen in a lot of people. A lot of people are actually quite shocked at how little their vitamin D changes over the summer. So that's something to keep in mind. So let's just say I put someone, they get to their levels, we get to their target of 150, let's just say. And then I say, okay, let's do a maintenance dose based on their weight. I will dose them at, let's say, 3,000 is their maintenance. So it's 3 drops a day. They stay on that for a full year. If their levels stayed pretty consistent around 150, then we're good to go. That's their maintenance dose. And if their levels dropped, we know that we have to go higher. So that's just a note on that. So it's not like a test once, set it and forget it situation. It is something that has to be assessed and reassessed. But once we hit that target, we essentially have a year of going through those motions before we have to relook at that. What does the research say on vitamin D? So I want to talk about a few different things because I saw a couple things come up. I've written it all down because I wanted to make sure I didn't miss any points. But when we look at vitamin D, we can do something called bolus dosing. How do you take the drops again? What do you mean? So you would do them directly in your mouth. When someone has super, super, super low levels, I will do something called bolus dosing. And what that means is you're just giving a ton of vitamin D at once. Now, again, I do this based on their levels and based on their weight. So I don't do this with everyone. I do this if their levels are like so low and I want to get them up as quickly as possible because below 50, your immune system is actually suppressed. And so what I may do is I may say, let's do 25,000 international units once a day for 12 days, and then we'll go down to our maintenance dose, right? Like that's an example of how we would bolus dose. Again, some people will say, well, what are the side effects of bolus dosing? And so there was a research study that came out, and they did a bolus dose of 500,000 international units. So I just gave you an example that I would often give like 25,000 a day for 12 days, right? This study looked at doing a number of different bolus dosing. And so they did 500,000 international units once. And they found that it acutely, so right after they did it, it acutely impacted bone metabolism. But the clinical significance of that was unclear. So basically they were saying that their bones, the fear is that when you throw way too much vitamin D into the system, that your bones will be affected in a negative way. But what they found was that there was no impact on calcium, no impact on blood pressure, and the impact of bone only happened very transiently. So it happened essentially like very closely after that dosing, and they don't even know if it was clinically significant. So I would say that as long as you are being monitored in terms of the dosing and the frequency and the timeline, then you're probably fine with respect to vitamin D. But you don't want to go just take bolus doses on your own. That's dangerous. And so what they found is that vitamin D in perimenopause and postmenopausal women is actually really important for heart health. And a lot of people don't think of vitamin D when it comes to heart health. So I wanted to talk a little bit about that, but specifically vitamin D deficiency. What they looked at is because as you're going into menopause, as you're entering perimenopause, your estrogen levels are reducing. That's just something that happens. And what they're finding is that vitamin D can actually help to buffer some of those negative effects that you experience because of that estrogen decline. So what does vitamin D do? So it increases intracellular calcium in your cardiomyocytes, and it increases contractility in the heart. So it actually has direct roles in the heart, and vitamin D is anti-inflammatory in the heart. Now, what we saw in this study was that a vitamin D deficiency actually increased free radical formation, and it increased cardiovascular risk specifically in women with low estrogen. So if you are perimenopausal and your estrogen levels are going down, having a vitamin D deficiency actually increases your risk of cardiovascular disease. And what they found is that maintaining sufficient vitamin D overcame the estrogen deficiency as far as cardiovascular disease risk went. So what I'm saying is that as your estrogen is declining, it's actually really, really important that we keep your vitamin D levels really stable and make sure that we're hitting those targets, because that can actually be a little bit of a buffer from a cardiovascular disease risk perspective. So doing that can actually reduce the risk, which I thought was really, really cool. And then when we look at vitamin D, it's also important to understand the relationship between vitamin D and K2. So vitamin D can actually also help with bone. It regulates calcium. We know that as you're going through menopause, your estrogen goes down, your inflammation goes up, your BMD, so your bone density, is actually, so this I actually found really interesting, but a reduced bone density in menopause is actually an independent predictor for early atherosclerotic cardiovascular disease in women. And like I said at the beginning of this video, you need at least 75 to be your level for bone health, and between 100 and 150 in the serum puts you at the lowest risk of cardiovascular disease and all-cause mortality. Now, how do we get vitamin K2? Vitamin K2 is an interesting one because it is found in, I always tell patients, like, it's found in the most random sources. It's found in fermented foods. It's found in animal products, specifically like beef and stuff. And it also is made by the microbiome. So your gut bugs will actually make vitamin K2. So that is another source as to where we would get vitamin K2. And so that's where you can find it. But interestingly, in this study, co-treatment with both vitamin D and K2 reduced inflammation, increased calcium absorption, and prevented blood vessel calcification. So I thought that was really cool. And specifically when we're looking at dosing vitamin D, I will often add in vitamin K2 specifically when I'm dosing over a certain threshold, because typically, like in every other, circumstance, your gut bugs kind of make enough vitamin K2 to balance out that D. But when we're taking a lot of vitamin D, we have to make sure that we're taking vitamin K2 in order to in order to buffer that effect. So that was interesting. And the other thing I wanted to say about vitamin D from the research, there's a lot of things that came up around hormone therapy that I want to talk about separately. But with respect to PCOS, we know that vitamin D helps in PCOS. But interestingly, this study looked at a vitamin D group, and they actually didn't dose that high. They did 4,000 international units over 12 weeks. Now, what I don't love about this research is they often will just give an arbitrary amount. And so the question becomes, would they have had a more significant benefit if they would have given a dose based on the individual person's level and weight? Unclear. But they tend to do this in research where they're like, let's give 3,000 or let's give 4,000, and that's fine. But I wonder if they would have had a better outcome if they would have dosed, if they would have like tested and been like, your levels are, 30, so you need to take 10,000, and your levels are, 78, so you need to take 5,000, right? Like that might have been a better indicator. But anyways, that's what they did for 12 weeks. And what they found is that BMI, waist to hip ratio, and serum insulin in the PCOS, in women with PCOS, these markers were lower. So they had lower waist to hip ratio, they had lower serum insulin, and they had lower BMI in the vitamin D group in those who had PCOS versus the control group. So we know that it actually did impact and it did shift these metabolic pieces. And some of the reasons for that is that the vitamin D receptor is actually a modulator of whole body inflammation, and vitamin D actually increases insulin responsiveness. So not only is vitamin D really important in perimenopause, in that postmenopausal stage, like I just mentioned, but also in PCOS, it is also really important, which we knew, but I just wanted to update on some of the latest research that I've been going through. And like I said, if you are on my mailing list, I will send this video out so you can rewatch it. I will send this video out next week when my email goes out. So if you're not on my list, head to the link in my bio and join the list. You can also identify if you want specific content tailored to people over 40, women over 40, or women 30 or under 40, basically. So that is an option, so you can get more tailored content. But I hope everybody enjoys their Friday and have a good weekend. And I have to go to my workout class. So I will catch you guys later.